Today we're going to focus on a therapy technique called flow phonation or stretch and flow phonation. And so I'm going to go through 5 different steps of how you would work on that with a client. And so the first step is you're just going to have the client focus on their steady airflow, and so creating that foundation to help them at step 5 where they're going to be using that in conversations. So you can either use a tissue and have it lined up with your mouth and your chin, or you could use your hand. So I'll show you both ways. So the first step, you're just going to focus again on your steady airflow, and it's going to look something like this. Or like this. And I like to have my lips a little bit rounded, kind of like you're drinking from a straw, which helps the airflow come out. And the step 2, we're going to add a little bit of sound, and that's going to be with the H. It's not going to be a voiced sound, it's going to be voiceless, just to again practice on the steady airflow with adding a sound. So this is going to look like and have it nice and easy, and you can have your hand or your tissue as a feedback with how your airflow is. So it could look like this. Awesome. Okay, so the next step, step 3, we're going to have the client introduce it with words. So this may be words that most likely have the letter H in the front and the initial position. So this would be like who, or how, her, home. And this step should be breathy and has a decrease of their speech rate. So you're just, again, creating that foundation for them to then generalize it into conversation. And then step 4, we're going to continue turning on the vocal cords and having that vibration in their vocal folds. And this would be like adding phrases once they've completed step 1 through 3. So this step would look like you're adding, how are you? Or let's go. So you're keeping that steady airflow, and the voice should be, again, breathy, but this time it's going to be at a normal rate. All right, in the final step, it's going to be you're generalizing all of these steps into everyday speech and everyday conversation. So you would practice with your client, maybe first in the therapy room and then maybe going out into the community and having them use their steady airflow to talk to people around them. Thank you for listening.